these days, the idea of autoimmune health and autoimmune health issues is certainly gaining a lot more attention. And for those people who have autoimmune health issues, they're probably going, it's about time. For those who don't have them, you may be wondering, what is it all about? What does autoimmunity really mean? And maybe you have a friend or a family member who's dealing with that, and you want to know how you can support them better. I am delighted to have my very dear friend and colleague, Dr. Keesha Ewers, here today, and we are going to unpack a little bit about what autoimmunity is and some of the things that you can do to get support and to be able to make sure that you are taking care of yourself. I'm going to start by telling you just a little bit about her, and then we are going to dive in. Dr. Keesha Ewers is the founder of the Academy for Integrative Medicine and Functional Sexology. She is an integrative medicine expert, an autoimmune disorder expert, a doctor of sexology, a family nurse practitioner, psychotherapist, board-certified functional medicine provider, Ayurvedic practitioner, medicine woman, best-selling author, speaker, and a mother of 4. That is such a mouthful and such a well-rounded bio. I love it. How are you?
I'm good. And thank you so much for having me. It's always such a delight to speak with you.
Oh, absolutely. And I love the work that you do helping support people. I know you have a couple of books on the topic. I know you've done summits on the topic. And so I guess I'd like to start by asking you, what is one of the myths that people face about autoimmune health?
That's a really great question. I would say that the only thing that they need to change or to do about their autoimmunity is to take medications and change their diet. That would be a really big myth.
Yeah.
We have to think about, do you want to reverse it or do you want to manage your symptoms? And so only shifting diet, taking medications, those two things will manage symptoms for sure to a certain extent. But in terms of really reversing it, there's a lot more. There's deeper tissue layers to get into there.
And I think that is such an important point, because for so many people, when you're first diagnosed, you're so overwhelmed and your body feels out of control and you're struggling on a number of different levels. And someone goes, here, take these pills.
Yeah.
And you're just looking for relief. And I will share my personal experience, because I am someone who's been down this road, is that I was offered a lot of medication and nobody really talked to me about food at all. And I had to learn that on my own. And then nobody talked about the other things. Before we get into the other things, can we talk about what are some of the foundational food changes that would be really beneficial for somebody to incorporate?
Well, there's a well-known framework now, the autoimmune paleo diet, right? Food plan. And that's a great place to start, but I'm not going to say but, I'm going to say and. There's no such thing as a diet that works for every single person. So each person, when you have autoimmunity, it means you're attacking yourself. And so there's not one textbook that a body reads that says, when you're trying to get your owner's attention, here's the button you push. There are going to be a whole bunch of them. And so it's going to really depend on your genetics as far as that food piece. And it's going to depend on your gut health as far as that food piece goes. It's going to depend on your already existing level of toxic burden as far as that food piece goes. So there are some things that you could say just across the board to start, because we always start with food. While we're waiting for other data to come back that individualizes your plan, we always start with these very basic things like don't eat gluten, get off of dairy, don't eat sugar, don't drink alcohol, get caffeine out of your world, take sugar out of your world, really corn and soy and processed foods. The things that we can't even apply the word food to them, but are called food, that's not what you eat. You don't want to consume things that lack nutrition and in fact have harmful ingredients in them that activate an immune response. So that's where you start.
And I think it's so important to recognize that there is that foundation that you're talking about: gluten, dairy, sugar, alcohol. Those kinds of things are certainly a great start. But I'd also like to point out for anybody who's listening that autoimmunity is a spectrum.
Mhm.
And unfortunately, the mainstream medical likes to compartmentalize it into little things. Oh, this autoimmune condition, that autoimmune
Right.
condition, this other autoimmune. And really, all it is, your body is not working the way it's designed to. It's just that's your particular expression of it.
You
And
have a 75% risk of getting another autoimmune disease once
right.
you have one, because of this very thing that you're pointing to, that you aren't, you're not a DSM-5 criteria for an emotional disease. You're not an ICD-10 code for a physical disease. And you're not any of those things. You have this body that's really desperately trying to get your attention, and it's using the only method that it has. And when you go in and try and shut it up, it's, if you're a parent or you have a memory of your own self as a child trying to get your parents' attention and having them just smack you or
Mhm.
turn away and ignore you entirely and walk out of the room. That's what we're doing to our bodies when we're just covering up what they're trying to say. And so we really want to pay attention to these beautiful bodies and really understand you get one. And if you're in a combative relationship with it, there's no winner. There's no winner there if you're at war with yourself. And so what you want to do is you want to say, oh, drop in with curious compassion, with the aim of being collaborative with all of the parts of your ego, all of the systems in your body, all of the layers of you, your physical, your energetic, your emotional, your mental, your spiritual. Become collaborative, compassionate, curious. And then you get into talks about cohering, and they did not invent this idea. This is where meditative practices from Eastern philosophy that are all geared toward that, right? Having coherence, not conflict. It's food is one part of that journey. It's driving your car into a service station and not yelling at the pump or at the car because you match it. What does the owner's manual say? And then you get the right, you get the right handle and you push the button and you fill it up and you drive away, and there's just no argument, right? And so that's what we have to do with this too. Yeah.
And I love that you're talking about really with compassion, with kindness, connecting with our inner selves, because I know for so many people, the initial expression of autoimmune dysfunction is so amorphous. It seems to be so many different things. We don't know what's going on. And if you don't pay attention to it, it just starts screaming louder and louder until we have this huge problem or this big issue going on. And so I'd love for you to talk about what are some of the other things aside from medication, aside from food, what are some of the other things that really help us to connect and then to soothe our system?
The first thing, and this was definitely my experience when I was diagnosed with rheumatoid arthritis when I was 30, when it was experiences all of a sudden for me. Overnight, I had 10 extra pounds of puffiness all over my joints, and someone had taken the batteries out of the Energizer Bunny, and I was flattened. And when I went in to see a doctor about it, she asked if I had a family history of autoimmunity. And I said, I think my grandfather had it. He died at the age I am right now in a wheelchair. So what we're going to talk about, he didn't know. I didn't know. The rheumatologist I was talking to didn't know. And so what we're doing right now is we're exploring down under the surface of the ocean to places that a lot of people never go, right?
Mhm.
We're taking it off that surface level of, oh, here's your symptomology with your disease. And then here is the cookbook that we have where we match the drug to that ICD-10 code disease, right? Which stays on the surface. And the surface is like subject to the wind and the chop and the so we want to get down below and look and see what's causing everything. when we talk about that, then it's not just one thing. We're
Mhm.
going to really want to explore. So when I was diagnosed, I went home with my 2 prescriptions, one for methotrexate and one for a non-steroidal anti-inflammatory drug. And the instructions my doctor had given me to come back when I got worse, not if. And I remember putting those down on the desk and then getting on the computer and thinking to myself, there must be outside of this paradigm a different way of thinking, which I had never explored up until this point. And so I went into PubMed and I found yoga and autoimmunity. And I went to a yoga class the next day. So I remember sitting there holding postures for the very first time in my life as a marathon runner and looking around the room to see how I measured up to everybody. True
Yeah.
story.
And why do we do that to ourselves?
I'm not very limber. Look at that. Oh my gosh. How did, and just like constant chatter of how I measured up to everyone else in the room. And was I doing this correctly? Was I doing it well? And like anyone that's practiced yoga and my current version of myself can go back to that 30-year-old version of myself and go, oh, sweetheart, and have a lot of compassion for her, because our society is such that we do a lot of comparing and despairing. We have social media. I'm sure you hear this. How come everyone else can eat this and I can't?
Yeah,
That doesn't even make any sense, that question. Like,
I know.
that doesn't even make any sense. It doesn't matter what anyone else in the world is doing. This is your journey. So the Keesha that was in a downward dog and couldn't get her heels on the floor, and by the way, still can't because I have such tight, became a yoga teacher and couldn't do it. We're looking around going, how does everyone get into a squat and get their heels on the ground? Oh, that one was the way that we're set up, and it causes a lot of frenetic, stressful energy.
Yeah.
Now, going into a downward dog, the idea behind yoga is that your eyes are turned inward, not looking around at the outside. Pratyahara, as part of the one pointed focus, when it is one of the limbs of yoga, that you stay focused, one pointed, you breathe into these different parts, you have compassion for them, you let them soften. As your mind softens, so does your body. These are the kinds of practices. Am I saying yoga is it? I'm saying no, the inward journey of bringing eyes inward instead of outward. And I find that women in particular with autoimmune disease have some personality similarities in that there's perfectionism, there's people pleasing, and there's holding on to the poison of past pain. There's patterning set up there that started in childhood. And there's a freeze state that will happen in the body of some of these feelings that happen in response to different events and meanings that were created and adaptive behaviors that are attached to those by an upset child that are now running the show in adulthood. And so that self-compassionate confrontation and inquiry with curiosity is really like the thing. That's it right there. And it's being able to turn eyes inward and ask questions rather than dictate and say, why aren't you behaving the way I want you to? When you're diagnosed with an autoimmune disease, oftentimes it creates a sense of betrayal. Like, I'm betrayed by my body. I can no longer trust it. But in fact, it's a waking up. Your body is not an inanimate object. And so this waking up to the fact that you're not a brain hauling a body behind it like a Neanderthal that's just clubbed it and dragging it. It's supposed to be a part of the team. It's supposed to have its own wisdom because it does. And when it's being ignored, just like a toddler, it will up the volume. And it's not trying to hurt you. It's not trying to interfere with your forward motion and your mobility. It's been talking to you for a really long time before that happens. And so it's being able, like, again, turning that inward, stopping with this out here of comparing and despairing, and beginning that process.
And I love that waking up concept, because you're right, it is an inward turning. It's more about appreciating what our body can do and learning also to recognize that every single body is different.
Yes. Every
And
one of them.
and somehow we grow up feeling like we have to be running alongside everybody else and competing with everybody else. And then all of a sudden, when we can't do that anymore, instead of stopping to look and say, why is this happening? The question most people start asking, and I hear this from my clients a lot, is what's wrong with me? And I know you probably said the same thing. I said the same thing when I first started my autoimmune journey. It takes a long time to learn to go, wait a minute, appreciate this beautiful body. I'm still here. I am still walking around, and look how far I've come. Look at the progress I've been able to make because I've reached out to what my body really needs and learned to connect. I think one of the other things that's so important for so many people is learning to slow down, learning to recognize when we need sleep or even just a nap, or not even a nap, just a rest. Our society does not encourage resting.
No, it's not productive. It's not achievement. We're very productivity oriented and achievement oriented. I started studying Tibetan Buddhism several years ago because what I started noticing was that of all people on the planet, these guys have really mastered the mind. They really have tracked it, documented it, and it's remarkable. So I thought, okay, I want to learn this. And learning to master the mind is never even talked about in our culture. Instead, we have, if you have a thought, it must be some kind of pearl and it must be true. Instead of learning to really question, just because you have a thought doesn't make it a good one, accurate, true, or something that you need to say or act on. So being able to self-confront your own thought processes and patterns of the way you think, what are the themes that you ruminate on, these kinds of things. They talk about the fact that there are 17 steps and one perception. They talk about 6 minds, not one mind. So our 5 sense organs, our eyes, our nose, our mouth, that these are bringing in information, and it's not simultaneous the way we think about it. You can only bring in an information from your eye mind and then a piece of information from your ear mind as you're watching this. They're toggling back and forth rapidly. They're not coming in at the same time. So if you think about a Super 8 movie and the frames slowing down, what they say is there are 17 different steps to, if you identify my color that I'm wearing as periwinkle, for example, from the old Crayolas, right? and you register that, you've just gone through 17 steps just to name a color.
Wow.
And you think about like how much is going on in each of our backgrounds and the animation of our faces and what we're saying. That's how active the minds are all working together. So what happens is we get, just like if you were commuting and you're going to the same place every day, you would soon get to a place where you're not really thinking about it. You just get in the car, you go, you arrive, right? And you've thought a whole bunch of other things, not about what the route was. And that's going on as our unconscious and subconscious programming all the time. And it's based on early childhood events, most of them uncomfortable ones that have created these patterns. And so when you think about that and you go, gosh, 17 steps for every piece of information I'm registering, all of these things, there's an amethyst, they're all coming in rapid fire, and you're making a meaning about them, naming them. And in between the stimulus and the response in those 17 steps, you can stretch that out. And what they say is how you've always thought about something or done something is how you're always going to do it. So they say you have to get into the middle of that process and open the door. They call it the doorway to karma, and say, okay, now instead of stimulus and reaction right there, stimulus and reaction, there's no space between them. You go like this and you have a stimulus and you have a response. that comes from an observer wisdom part of you that looks and evaluates and says, what I'm thinking right now may not be of value and it may not be in my highest and best good or who's here with me. And so what else could I do now instead of that? And so that requires slowing down. It requires, this shows up in eating when we talk about mindful eating, slow eating, right? Not sitting on the couch and binge watching something while you're binging on a food, that you slow it down. You check in with your body. You say, what am I hungry for? Am I really hungry for physical food? Or is it more emotional, mental, or spiritual nourishment I'm looking for? And how do I get that? And it's the same exact thing. You're doing stimulus response, creating a gap so that you can actually investigate with compassionate curiosity.
And I love that because I know for so many people, I know for myself, for clients, for other people that I've talked with, anyone who has an autoimmune disorder, I feel like it's at a higher level. What we're talking about benefits everybody, whether you have an autoimmune disorder or not. But that learning to slow down, that learning to derail that reactionary response and really develop a more mindful pause and then begin to build from there is really helpful. And I think it's such a hard thing because we're not taught this. This is not something that we grow up learning how to do. And to have to incorporate that is really challenging.
Which is why I saw outside of our cultural paradigm when I thought about, gosh, I would like to gain mastery over my mind. It thinks it's in charge. Like it's a bully, right? It looks in the mirror, this is years ago, and says, I can't believe I'm getting jowls. Or, oh man, that belly, it just pooches after those 4 kids. This kind of like critical evaluation of the body rather than, and oh, my hands hurt. Why do my hands hurt? Why can't it just like work? Why can't things just work? And it's this critical, why aren't you, if you think about being a child that with a parent that's like that, here you've spent all this time cleaning the bathroom and your mom walks in and goes, and does it for you or again and complains, like you're never good enough. The body is just, you have to realize that's also what you're doing. You're abusing yourself when you're like that. It's abusive. It's a form of abuse. And also when you look at a younger version of yourself and a choice that version made, and you criticize her, him, or they, because that's also a form of abuse. They were working with what they had available to them, and you can't go forward with 20/20 vision and then come back and go in that hindsight like, what an idiot, right? And so there's so many flavors of that we engage in that are self-abuse. And oftentimes, again, like people with autoimmune disease have past trauma already, and they're upset by some need they didn't get fulfilled or something that happened for them that didn't go the way they would have wanted it to, and yet they're perpetrating it on themselves in an ongoing manner.
They haven't learned to stop and slow down.
And become the parent that you want to have had for yourself.
And this is where we all need to go back and just give our younger selves a hug and go, okay,
I've got you. You're safe now. Look at what, you've grown up, you survived, you did an amazing job in surviving. And now we're going to, and it's just like a phone. When you take this out of the box, you don't stick with whatever is there. You go in and you start playing with it and putting your own little screen on, and you choose how you want it to be, and you choose what chimes you want and all of that stuff. And this is your adult self going back to that default setting and being able to do that. You're upgrading your operating system.
I love that. Upgrading your operating system. That is such a great way to put it. I'm actually going to write that down. No, I really like that. So this is such amazing information and so wonderful. What would be something that you think would be a good place for someone to start outside of the medication or the food? Like for you, it was yoga. For me, it was meditation, learning, just approaching a lot of different mindfulness practices. I know for other people, it's different things. What are some easily accessible things that you think
Yeah,
someone?
I don't advocate yoga or meditation right away because it can be, if you've lost a lot of mobility, if you do have a very busy mind and you don't have the right human design, that's the thing, is we're all different.
Yeah.
And so if you're designed differently, your enneatype, your human design framework, your astrological chart, like all these things are you and what you're designed for. And so it's not right for everybody to go immediately into a yoga class the next day or just try and sit down and meditate. I usually will start with something that everybody can do, which is spend 24 hours while you're awake. So, however many hours of those you're awake, really observing your own mind, where you just pay attention throughout the day as you're driving, you're cooking, you're working, you're getting up in the morning, you're going to bed at night, and noticing, really paying close attention. Takes a lot of effort because there's a lot of checking out that happens, but really notice the thought forms that you have and what are the themes and the threads and what's the tone you speak to yourself in and think about others and life circumstances in. And, are you kinder to strangers than you are to yourself, or vice versa? That can also be switched. So what is it that comes up for you as a pattern that you start to notice? And just journal about that, just without judgment, just notice. And there's a nice little exercise you can do where you take a little handful of black pebbles and a little handful of white pebbles, and for 3 weeks, every night before you go to bed, sit at a table or on the floor or in your bed, get your pebbles out. And then as you have journaled and observed your thoughts during the day, put a black pebble in for every one of the thoughts that was not very life supportive, not very self-nourishing, not nourishing to others. And a white pebble for everyone that was life supportive, nourishing to yourself and others. And at first you'll notice that there's a big old pile of black ones and not very many white ones. But when you have the exercise happening, you'll start, because those black pebbles and white pebbles, they're kinesthetic now, they're visual. You've used all of your minds to engage with this. You'll be able to catch yourself during the day and say, oh, that's a black pebble thought. Okay, let's switch it to a white pebble thought. And you'll start to just gradually be able to shift that ratio.
Yeah, that reframing is so important. And again, that gets us out of, and you bring up such a good point, because often when we're not kind to ourselves, it starts to spill over, and then we're not kind to the rest of the world around us. And if we can learn to begin to shift and reframe, we not only become hopefully a kinder, gentler version of ourselves, but we become kinder and gentler for ourselves.
If you're an Enneagram type 2, it's going to be the opposite, which is why I said it'll be different for people, where you'll notice you're kind to other people, but you're not really. You're being outwardly kind because you want something back. You want kindness back. And you start noticing, like, oh, that's a black pebble because I'm doing this in order to feel safe, to feel loved, to feel worthy, right? Whereas a 6 Enneagram that automatically doesn't really feel safe in their world will notice that they're kind to their environment, but not to other people. So there's going to be like this, it's motivated from different places for all 9 of the Enneatypes. So it's really fascinating. Yeah, so you'll start to discover yourself a little bit.
That does sound fascinating. And again, that all of that simply requires learning how to get more in touch with yourself and more in tune. Keesha, this has been absolutely amazing. I just learned so much every time we talk. I always learn so many fascinating things from you.
I always have so much fun talking to you, Myra.
You know what? I appreciate the work you do and how much you help and support others and how much you share so that people can grow and learn. If people wanted to connect with you, where would they find you?
At Keesha.com. And
So,
solving the autoimmune puzzle book. And I will say, like, anyone that's listening to this knows that Mira Dessy is also the same. Lots of information, so much kindness, such a big open heart. And I just appreciate all the work that you do in the world.
thank you. And I hope I get to see you in person again one of these days soon. Who knows?
Me too. Me
Yeah.
too.
Thank you so much for joining me, for sharing your brilliance and your huge heart. Folks, I will put all of the links down below, so be sure to connect with Dr. Keesha, and I'll make sure you have links to her books as well as to her website. And if you're new to the channel, please make sure that you click subscribe down below and hit that bell so you'll know when we have new videos coming out. Thank you so much for joining us. Keesha, thank you so much again for sharing. I appreciate you.
My pleasure. Bye, everybody.
Bye-bye.